And so here is Dr. Cassells.
I'm not used to microphones, so please forgive me. Are you sure we have enough of police here to handle this rowdy crowd? And who made me follow that song and that poem? Anyway, good evening. I'm Dr. Chris Cassells, a practicing orthopedic surgeon here in Wilmington. My father, Dr. Ward Cassells, founded the practice here in 1949. And his mentor, my godfather, Dr. Alfred Shands, founded the A.I. DuPont Children's Institute. So, as you see, healthcare is my life and my calling, and that calling is coming to an end. We doctors are the victims of our own success. Frankly, we have kept too many of you alive too long. And you are costing the government too much to live. Anybody here in Medicare? Get in line and get used to it. The driving force behind so-called reform is escalating Medicare costs and, to a lesser extent, for-profit insurance rates. Private health insurance, introduced during the FDR wage freeze during World War II, and Medicare, introduced in the 60s, created an inflationary decoupling of cost and benefit, and eliminated the free market system and the system of our charity hospitals where young doctors trained. Healthcare costs are now concentrated to the last few months of life. Since too many people have lived too long and are expected to cost a lot before passing, they are the low-hanging fruit to fix the bankrupt Medicare system. Frankly, from an actuarial standpoint, they need to die sooner. Current legislation, as passed, is front-loaded to eliminate care for seniors, which, make no mistake, will shorten lifespan. To enumerate it, and you can get this from the House Ways and Means Committee, there's about an 8-year phase-in. In the first 2 years alone, there are 2 major Medicare fee cutbacks to large hospitals, 2 of them. One major cutback to home health services, cutbacks to extended care and rehab facilities and nursing homes, and one cutback to psychiatric hospitals for Medicare patients. As of March 31st, unless the Senate acted today, Medicare fees to doctors dropped 21%. If you spend less money on seniors, their lifespan will shorten. If you pay hospitals less, they will spend less on your care. Fewer nurses, cheaper medicines, and earlier discharges. I think you get the picture. As we speak, the Wall Street Journal projected this week a shortage of 150,000 doctors in the country within the next few years. This does not account for the approximately 1/3 of doctors who, according to the New England Journal of Medicine last month, will retire in response to this legislation. Most doctors I know are going to immediately restrict access to their practice. Personally, we have cut employees and expenses, and as Pete points out, healthcare delivery is a sizable part of the economy, so look for more joblessness. There will be limited access to care. It's called rationing by inaccessibility. Fewer services, more patients, get in line for a long wait. If you don't like your insurance company denying coverage for services, know that Medicare denies more care than anyone. This is only the beginning. This outcome, strangely, is profitable for the government. I call it culling the herd. Make no mistake, this legislation does not fix health care. It intends to fix the insolvent government's bankrupt insurance products, Medicare and Medicaid, but probably won't do that either. It does raise taxes on everyone who pays taxes, currently 53% of the citizen population. It will not increase access to actual health care for anyone. It will ration delivery of care, first to Medicare and Medicaid recipients, then in 8 years to everyone when the private industry will have been taxed out of existence. It needs to be repealed and fixed incrementally by people who actually know what they are doing and actually care about people. So who do you trust your health to? Your Congress? Your IRS agent? Your lawyer? The healthcare provider who works for the government clinic, who is assigned to you? Or your doctor? Frankly, it's up to us. Thank you all.